Hi, welcome to Healthy Living. I'm your host, Amy Bouton, and I'm here today with some cardiologists from our cardiovascular clinic, and we're going to start our conversation today with Dr. Paul Stahls. Dr. Stahls, welcome.
Thank you. Thank you for having me.
Dr. Stahls is a cardiac electrophysiologist, and he has been with St. Tammany for quite some time. Can you tell people a little bit about your background for people who don't know you?
Sure. Grew up in New Orleans, Jesuit High School, went off to A&M, Ross University for med school, and then Ochsner for training. And out of my second fellowship, electrophysiology, came here in 2013 and began to work with the group with the hospital, and have been building the electrophysiology program since that time.
Okay, so tell us a little bit about electrophysiology. What is that for people who don't know?
Yes, the heart is a very complex organ, and when you think about it, it's a muscular pump. But that muscular pump has to coordinate its actions like any athlete does, let's say a throw, a pitch, a bat. And that with that coordinated muscular motion, you get the optimized blood flow or hemodynamics. And so the electrical side of the heart drives the hemodynamics. Now, we can get into conversations with our plumbers, as we call them, our interventional cardiologists, and they say, well, the blood flow has to be there, and it certainly does. But the electrical, the electrical side is really where the coordination of the muscular movement comes into play.
Okay, and so that's important because your muscle has to be working optimally for all the blood to flow. So basically.
That's it. It's
all
life.
right, well, good. Well, tell us about some of the things that are going on as far as treatment options for electrophysiology for cardiac patients and things like that. What are you seeing right now?
We're in a era of medicine, if you want to look at it just a bit more broadly, and then I'll bring us back into today. You're looking at a field that I practice in medicine that didn't exist when you and I were born. So within the 1980s and 90s is really when electrophysiology started to catch stride. The mechanisms were being teased out, the understanding of the electrical side of the heart was really being honed. And then the question of not just understanding what it is to be normal, but then abnormal, and then what in the heck do you do about it?
Right.
So we're in a transition period now from what I would say where the 90s was really the eye-opening decade. The early 2000s was wrestling with medicines versus interventions, but the interventions have continued to evolve and to hone. And so the medicines haven't really changed that much, but we're learning different roles and different ways to approach these things. So ablation is one of the top electrophysiology procedures to do to adjust the wiring within the heart, adjust how it either flows normally or abnormally.
And what is ablation? What exactly is that?
So I can go inside of the heart through the veins, and I typically get access in the groin through the veins, come into the right side of the heart, and pass very thin catheters, about the thickness of a piece of spaghetti with little electrodes on them. And then I can study how the electricity flows through the heart, determine what are bad wires, if there are any, or what area is diseased. And when I refer to disease, it is more about at a cellular level than, oh, look, I have a broken bone, can you fix my bone? It's a lot more at the biochemical and cellular level. But understanding where in the heart these things originate from, I can then go in and either modify with heat energy or freezing energy. And the idea is to purposefully scar, because scarred or dead cardiac myocytes can't conduct electricity. So it's sorting how to block the flow of either the normal or abnormal electrical signals within the heart.
So all of this, at the end of the day, it's to increase the patient's health, obviously, and their quality of life. And you have been talking about the Watchman procedure as a newer and more current thing that you guys are doing. So tell us a little bit about that exactly.
Yeah, so the Watchman device came out about 7 or 8 years ago, and we've been trying to get it here at St. Tammany for that period of time. And we've finally begun. And it's a new addition to what we call our structural heart program, and I'll elaborate on that in a minute. But the Watchman device is a small little smushy basket, if you want to think about it that way, about the size of a quarter, about the size of a stack of about 4 or 5 quarters, and it can compress down and go into a little small area of the left atrium called the appendage. It's a small little out pouch where we estimate about 90 to 95% of the clots that form inside the heart develop within that pouch. So then what we can do, instead of use blood thinners to keep the blood from pooling in that area and forming clots,
Right.
because they're rife with their own list of issues, then the Watchman device can be inserted from inside the heart into that appendage and occlude that area of the heart so that blood doesn't flow there any longer. Procedure takes about 30-45 minutes. You're home same day. And it's really going to, I think, change the complexion of our ability to prevent clot formation within the heart. You may ask yourself, why don't I want a clot in my heart? Well, because with every single heartbeat, 20% of it goes to your brain or so. So the risk of stroke is very high. But that clot can travel off to your toe, to your gut, to your kidney, to your eyes, anywhere. And
Right.
lack of blood flow is not good. The body likes oxygen and needs it, and without that, tissue damage can occur. So.
And so candidates for this are people that I've read a little bit about it that are on blood thinners right now. So does it prevent them from taking them in the future, or can it prevent them from being on a medication for the rest of their lives?
That's the goal. And that's actually one of the biggest things with electrophysiology in general that I was attracted to, is my ability to do a mechanical fix and remove the need for medicinal therapies. Now, that's not always the case, but in this case it is. And so with the Watchman, on the day of implant, instead of being on Coumadin or one of the other very strong blood thinners that we call NOAC or DOACs, that's Eliquis, Xarelto, Pradaxa, those kind of drugs. Once we implant that, you can come off those medicines. 2 antiplatelet drugs, aspirin and Plavix, are the predominantly used alternatives. And then really for about 6 months, you monitor with echoes and make sure that that area is getting closed off with scar tissue.
Right.
And then the patient can go down to just an aspirin a day at the end of that, or nothing, depending on the other indications. So the point is within really a day, we can take your stroke risk and your need of prophylaxis using a strong blood thinner and stop that.
And potentially for
Life.
life. Well, that's amazing.
Yes.
That is amazing. So let me ask you this. Let's talk about the clinic itself. We just had some changes in 2023. Talk about that.
Yeah, so we added 3 new partners. One, a senior gentleman in the community, Dr. George Isa. He's a structural heart guy, interventionalist, and a great addition to our group. Then 2 new young gentlemen just came out of fellowship, Dr. Stefan Sachinsky and Dr. Hafiz Ghafour. Dr. Ghafour is an interventionalist who trained at Tulane, and Dr. Sachinsky is one of our non-invasive consulting partners, who's really an imaging specialist who's joined us as well. So we're very excited to have grown, almost doubled in size in a year. And then the second part was, we as we looked around and saw these new people at the table, we said, now what do we do with all of us? And
Where are we going to put everyone?
That's right. So we realized our clinic was not going to be able to handle everybody every day doing all the work we needed to out of it. And working with St. Tammany, identified a couple rooms in Mandeville at the St. Anne Clinic over there. And so we've opened a clinic there now once a day. Or let me say, one of our attending cardiologists goes there every day for the week. And so it's been a great response.
So now 2 locations. That's great.
That's right.
Is there anything else that you want to add about heart health, about your philosophy, anything at all before we wrap up?
Yeah, so I think the key to health is the basics. And you hear it, but it becomes lost in the noise sometimes. But really, diet and exercise. And so maintaining a good diet and treating food like a medicine will serve you well. And if you see it on TV, you probably shouldn't eat it.
If you see it on TV. I've never heard that one. That's a good one to remember.
And you know, when you go to the grocery store, I tell a lot of patients, shop on the edges. So your fruit, vegetables, meat and poultry, and then you're out of there. Processed foods in America are really probably our bane. Tobacco smoking, as nice as it can be, if you want to have an argument about it, it just can't be done on a regular basis, or you will pay the cost and need one of us to be your doctor. After that, the human body was designed to live in the wild. And so this whole thing of the concept of exercise isn't so that you can wear your jogging pants and be proud. It's because our machines were made to move. And if you don't move these machines and use the muscles and keep them strong, as we age, bad things can happen, and physically, you know, in regards to injury, but also other medical conditions can develop.
That's all good advice and a good way to put it. We were made to live in the wild, so movement is natural.
That's it.
Exactly. Well, thank you so much for joining us today and taking the time out. We will be right back with Healthy Living.
The North Shore has always marched to the beat of its own drum, and the cardiology team at St. Tammany Health System has always stayed in rhythm with the community we love so much. Here, many talented specialists and subspecialists devote themselves to providing minimally invasive cardiac surgery and the latest advancements in cardiac disease prevention. Together with our partner Ochsner Health, we're making St. Tammany hearts beat stronger.
Welcome back to Healthy Living. We're here now for our second segment with Dr. Stefan Sachinsky. He is a cardiology specialist with St. Tammany Health System. So thank you for making time to come today.
Yeah, thanks for having me.
So let's talk a little bit about you because you're relatively new to the practice. So tell people who are watching, our viewers, a little bit about your background and about what you love about what you do.
Sure. So I'm from New Orleans. I went to college at University of New Orleans. Afterwards, I did my medical training at LSU, School of Medicine in New Orleans, and then I briefly did my training in Shreveport, where I went for residency and cardiology fellowship. And afterwards, I'm returning to practice on the North Shore. And I'm very happy to have joined St. Tammany Health System. Now, originally I was born in Eastern Europe in Moldova, so I do speak Romanian as well. I came here with my parents at a young age and kind of grew up in the New Orleans area from about age 9 or 10 or so. So if there's any Romanian-speaking patients, I'd love to see them as well.
Yes.
I'm bilingual.
That's good to know. That is good to know. And it's nice that you're back in your home region, your second home, New Orleans region.
Correct,
so we're glad to
yes.
have you. So tell us a little bit, a cardiology specialist. Tell me about tell us and the viewers, what do you focus on as a cardiology specialist?
Yeah, so I practice general cardiology, so I see patients in clinic, I see patients in the hospital, I perform procedures such as diagnostic catheterization or transesophageal echoes, and I also read echocardiography and vascular ultrasound, and also any sort of stress testing, whether it's an exercise stress test or nuclear stress testing. So we have a lot of different options for our patients in clinic, and depending on what kind of condition you have, we order the appropriate test. And we're able to evaluate more than just the heart. We kind of evaluate the entire cardiovascular system. So I'd like to emphasize that we also do vascular testing. So renal artery stenosis that can give you unexplained high blood pressure. If you have pain in the legs, we're able to look for any sort of blockages in the peripheral arteries. If you have strokes or mini strokes, we can look for any blockages in the neck arteries, because if you have cholesterol plaque in these arteries, it can give you strokes or mini strokes. So it's a good idea sometimes to even preventively evaluate those arteries. For example, I listen for bruits in all my patients, and if I hear any sort of abnormality, then we order an ultrasound to make sure we catch any sort of these blockages ahead of time.
So stress, the importance of the whole cardiovascular system is obviously connected. So tell people that are watching, what is the importance of being aware of that connection?
Sure. So it's important to do kind of preventive healthcare and preventive screening. So I encourage patients to actually come see me before they start having problems, kind of sort of like a screening visit.
To get a baseline, sort of?
Correct. We can evaluate the cholesterol, we can check for any sort of early problems that could lead to plaque buildup over time. And also, if you have any sort of issues, then we can investigate further with kind of an array of tests that we have.
So speaking of sort of that preventative step, what can you do just in your everyday life to keep your heart and your cardiovascular system healthy as a whole? What are some lifestyle things that you would recommend?
Yeah, so I encourage, I go by the American Heart Association guidelines, 150 minutes of aerobic exercise per week. And that can come from, you can have 1 or 2 serious workout, intense sessions that get you to that 150 minutes, or you can just go for 30-minute walks every day. You want to get your heart rate up to 100 beats per minute or more when you go on these walks in order to get these aerobic exercise benefit.
Right.
And one thing that patients can do is get these smartwatches, such as the one you're wearing.
Okay.
It looks at your heart rate, and they also count the minutes that that are meaningful exercise minutes. And it's a great way to kind of keep yourself in check whether this week you've done enough exercise or not. The other brand that is good at doing that is Fitbit as well.
Okay. So what have you seen since you've been with St. Tammany Health System as far as the way the cardiology is practiced at our cardiovascular clinic?
Well, a lot of advances have come, recently with imaging, which is great because patients don't need to undergo invasive testing as much as they did in the past. One new technology we've seen in practice is cardiac CT. Cardiac CT is great because it can give us information about the blood flow to the arteries supplying the heart, and we can find a lot of information now just by doing a CT without having to take the patient to the cath lab and do a procedure which carries risks.
Right.
So it's great because imaging is getting more advanced and we're able to identify disease earlier and do steps to treat it, before patients come in with a heart attack.
And we were talking earlier, you were saying that when a patient comes into our clinics, they see the same doctor, pretty much.
Yes, so one of the benefits of the St. Tammany model, which is different from other institutions, is that you get to follow your patients, or the doctor follows you as you are admitted to the hospital. So for example, I see my own patients in the hospital, and the benefit of that is that if I see you as a patient, for example, I know you, I know that you've had an echo done or an ultrasound done recently. So when you're admitted and I'm consulted on your case, I'm not going to order unnecessary tests, and you're not going to have extra bills because you've had an ultrasound a month ago and it was normal. So if you go in other big academic centers, you usually are seen by a bunch of different doctors that don't know you, and that leads to unnecessary testing in my experience. But if you come to St. Tammany and you follow up with your, not just me as a cardiologist, but your gastroenterologist, or if you follow with your primary care physician, then you have this continuity of care. So it's easier when you're admitted into the hospital to take care of you and do less unnecessary tests.
So it's a very good relationship building model, it sounds like.
Correct.
Is there anything else you want to add before we go? Talk to our viewers tell them anything about your practice or yourself before we wrap up.
Not just my focus is on preventive care. I'd rather, it's better to catch the disease early before it becomes a problem. And we have a lot of technology available at our fingertips. And it's a shame if it doesn't get put to use and we get the maximal benefit out of it, which is why I encourage everyone to make an appointment with your local cardiologist so you can get checked out.
Okay, well, thank you so much, Dr. Sachinsky. And we will be right back with Dr. Kavor, our interventional cardiologist.
Any nurse looking to start a career or already working as a nurse and want to advance your career, St. Tammany Health System really is the place to work. We have a great culture here. We collaborate.
It's a small town community feeling. Culture here is about the patient outcome and about the nurses at the bedside. The patient to nurse ratio is on the lower end here, and that enables us to deliver great quality patient care. I I also like the administration here at St. Tammany. I feel like they're very supportive of what nurses have to say, and they really do try their best to make this a great place to work.
It's like a big old family here. We offer great pay, great benefits, and it's like home.
I've been at St. Tammany Health System for 16 and a half years, and it's primarily because of the culture, the pay, the benefits, and the opportunities for career and educational advancement.
Welcome back to Healthy Living. We're here with Dr. Hafiz Ghafour. He is an interventional cardiology specialist at St. Tammany Health System. So welcome, and thank you so much for making time to be here today.
Thank you very much for having me.
So your background, I was reading your background, and it is quite broad and deep, and I'd love for you to tell viewers about your background.
So right after medical school, I started doing some research. I wanted to learn more about cardiovascular system. So I went to University of Tennessee, and I started doing research in basic sciences, where we were looking at the effects of high blood pressure, high cholesterol in animals. So we were feeding them, high cholesterol diet, and we would see what was the effect of different medications on the animals. Mm-hmm. And that, gave me, an idea, and, made me feel like this is exactly what I want to do for the rest of my life. So I became an internist after doing internal medicine residency for 3 years. I practiced as an internist for 4 years, and then because cardiology was always something that I wanted to do, so I decided to do additional training for 3 years. I went to Worcester, Massachusetts for general cardiology. Mm-hmm. And then after that, I decided, to move back to Tulane, move back to the south to Tulane, and then I did additional training in interventional cardiology for a year before I joined St. Tammany Hospital.
Okay, so let's talk about interventional cardiology. Uh-huh. So tell us a little bit about what exactly does that mean? What do you do exactly?
So cardiology is, of course, cardiologist is a doctor who treats a heart. Mm-hmm. But, so cardiology has different fields under the one umbrella of general term cardiology, which includes heart failure. It also includes any electrical issues with the heart, mm-hmm. and it includes the issues with the vasculature of the heart. So it's called cardiovascular. So vascular issues in the heart can cause abnormality like a heart attack. Vascular issues in the neck can cause a stroke. Vascular issues in the legs or poor circulation. So interventional cardiologist is someone who has done additional training for a year or two to be able to perform procedures. So what procedures we do is minimally invasive procedures, mm-hmm. where we are able to get access in a small artery, like in the wrist or in the groin, from a radial artery or the femoral artery. And we go up to the heart. We put small catheters, like small tubes inside the heart. And then we can perform procedures and provide therapy. The most satisfying thing, I would give you an example, is, for example, someone who's having a heart attack, mm-hmm. and they can be very sick. So once they come to the hospital, so we take them to the cath lab, and we are able to do that minimally invasive procedures, go up inside the heart, and restore the blood flow after putting wires and different catheters and putting other equipment. And that we can save someone's life.
Wow.
Same thing is if someone who has poor circulation in the legs, mm-hmm. like someone who has had chronic ulcer, that we normally see in diabetics, a poorly controlled diabetes. So in that case, we can also open up those blocked vessels which are causing limited blood flow. And we can restore blood flow and help circulation and wound healing.
Wow, and so these treatments that you're talking about, these interventional treatments, they can last a long, long while with the right steps by the patient,
with the right
correct?
steps. So it also includes, the patient has to be a part of the treatment.
Right.
So we have to do prevention. We have to make sure that we are managing their other factors, mm-hmm. other risk factors, other medications, other, conditions like high blood pressure, diabetes, high cholesterol. So all that comes into the play together. And in our group, we have this comprehensive team where we manage everything. We, as a team, discuss with the patient, discuss with their primary care physician, and tell them these are the tests that were ordered previously, and we are ordering these tests. So everything is in one collaboration and communication with all the physicians. Correct.
Yeah. And so we were talking about how heart health is essential to the health of the rest of your body, basically.
Correct.
And this is some examples of why you kind of have this collaboration and what you do together.
Yes, because like people have this idea of interventional cardiology, so it's different from open heart surgery. So open heart surgery is a totally different specialty, it's a different expertise. Interventional cardiology is, like I said, minimal invasive, where we're actually able to perform procedures without having to do any surgery.
So do you do any diagnostics?
Yes, I am a trained cardiologist. I'm a board-certified general cardiologist and board-certified interventional cardiologist. So my basic training is in cardiology. So we do perform all the diagnostic procedures. And now, at this time, we do have so much advances in the cardiology per se and interventional cardiology that we are able to perform these procedures which are non-invasive. We can risk stratify patients. So if someone comes to me in the clinic and they are, like, say, referred to me by their PCP, or they're referred to me by, by themselves, or someone told them they should see a cardiologist. So we look at them as a whole and see what they're going through, what are the symptoms, a good history taking and physical examination. Then from there, then we ask them what's going on with them, what are the medical issues. And then we use the screening tools, and then we risk stratify. So we have multiple tests that we can do, but not one test fits all. So looking at every patient, then we decide. We can do a CAT scan, we do a calcium score, we can do a stress test. And based on those tests, we try to, first of all, prevent someone having a heart disease. If someone who does have heart disease, then we try to treat it early on, rather than it becomes complex. And all this is, like I said, it's a whole process that, goes together.
To treat the whole patient.
The whole patient.
So we talked about your research a little bit. So let's talk about prevention, because we talked about it with your colleagues, Dr. Stalls and Dr. Sachinsky. So what are some things you'd like to add about prevention or keeping yourself healthy?
So for the prevention part, the most important thing I would say is follow up with a regular doctor. It doesn't have to be a cardiologist. And even in the younger age, like I would recommend highly that you start following up with the regular doctors. At least your yearly checkups are very important, which for some reason we don't do it a lot because we think we're young and we're healthy. But that is the most important thing, because catching something early on, something as small as high cholesterol, which can be beneficial in the long term.
Right.
And then like routine physical activity or like regular exercise. I typically suggest my patient at least 25 to 30 minutes of exercise every day, and which adds on to if, like American Heart Association recommends 150 minutes a week, so which comes to about 30 minutes a day, and if we consider 5 days weekday, and monitoring your vitals, blood pressure once in a while, especially if you're seeing a regular doctor, they will check your blood pressure, they will check your cholesterol.
Yeah.
And just healthy habits, eat healthy, try not to smoke, try not to do any like drugs, and just regular exercise.
Okay. Well, is there anything else you want to add before we wrap up our conversation today?
So I would just say that we have a very comprehensive tools that are available to us at St. Tammany and in our clinic. We have all subspecialties, like I talked about, under one roof. That we have EP, which is electrical issues of the heart. We have general cardiology that Dr. Sachinsky does. We have imaging. We have one specialist who does all the imaging work.
Right.
And then we have interventional cardiology. And there's another field that people are not aware of called structural heart disease, where we are able to do minimally invasive procedures and able to replace the cardiac valve, like aortic valve, and through like femoral artery, rather than having to go through open heart surgery. So we have a great team in a clinic, and we all work together. And if someone would like to, establish care at St. Tammany, I think they'll be in good hands.
Well, thank you so much.
Thank you very much.
Sounds very comprehensive and welcoming and thorough.
Thank you.
And thank you for coming and joining us. And thank you for joining us for Healthy Living. We'll see you next time.